Welcome, doctors. Let's talk about something that's probably keeping you up at night more than it should: healthcare billing. I know, you didn't go to medical school to become a billing expert. We are dealing with insurance nightmares and patient complaints about confusing bills. You've probably experienced this firsthand. A patient comes in frustrated because they received a bill they can't understand, or worse, your practice is dealing with denied claims that should have been straightforward. It's exhausting, and frankly, it's taking time away from what you really want to focus on: taking care of your patients. Here's the thing though, there's a solution that's transforming how healthcare practices handle billing, and it's called automation. Now, before you think this is just another tech sales pitch, hear me out. This is about getting your life back and making your practice run smoother. Think about your current billing process for a moment. Your staff is manually entering insurance information, trying to keep track of different coverage rules for every single plan, following up on claims. Meanwhile, patients are calling confused about charges they don't understand. Sound familiar? Automation changes this entire game. Instead of your team manually coding every procedure and hoping they got it right, intelligent systems can automatically assign the correct medical codes based on your patient records. No more second guessing, no more denied claims because someone accidentally used the wrong code. And here's something that'll really get your attention: automated systems can verify insurance eligibility instantly. Remember those awkward conversations with patients who thought their procedure was covered, only to find out later it wasn't? Those become a thing of the past when the system checks coverage in real time. Let me paint you a picture of how this actually works in practice. A patient comes in for their appointment. While you're focused on their care, the automated system is already processing their insurance information, calculating their exact copay, and preparing their claim for submission. By the time they're ready to check out, everything is accurate and transparent. Your patients start receiving bills that actually make sense. Instead of cryptic codes and mysterious charges, they get clear, itemized statements that explain exactly what they're paying for and what their insurance covered. Suddenly, those frustrated billing calls to your office start decreasing dramatically. But here's what I think you'll appreciate most: your staff isn't drowning in paperwork anymore. They're not spending their entire day on claim submissions and follow-ups. Instead, they can focus on the complex cases that actually need human attention, or better yet, spend more time supporting patient care. Now, I want to address something you're probably thinking: this sounds expensive and complicated to implement. Most modern automated billing systems are designed to integrate with the electronic health record systems you're already using. You're not starting from scratch here. The key is choosing the right platform and making sure your team is properly trained. Yes, there's still human oversight needed, but now your staff is managing by exception rather than doing everything manually. They're handling the complex cases and letting the system take care of the routine stuff. Here's what practices are seeing when they make this transition: claim approval rates go up because everything is coded correctly from the start. Reimbursement cycles get faster because claims aren't sitting in limbo due to errors. And perhaps most importantly, patient satisfaction improves because they finally understand what they're being charged for. Let me share some practical advice if you're considering this. Start by looking at your biggest pain points. Are you dealing with a lot of denied claims? Are patients constantly calling about billing questions? Are your staff members overwhelmed with administrative tasks? Automation can address all of these issues. The data analytics component is something that might surprise you. These systems don't just process bills, they help you identify patterns. Maybe you'll discover that certain insurance companies are consistently denying specific types of claims, that patients are struggling with payment timelines for particular procedures. This insight helps you make better decisions about your practice operations. I want to be realistic with you though. Implementing automation isn't a magic wand that fixes everything overnight. You'll need to ensure your team understands how to use the new system effectively. You'll want to monitor performance metrics to make sure everything is working as expected. And you'll need to keep the system updated with the latest coding requirements and insurance regulations. But here's the bottom line: healthcare billing doesn't have to be the source of constant stress and frustration that it is today. Automation gives you the tools to handle billing efficiently and accurately, which means you can get back to focusing on what you do best: providing excellent patient care. Your patients will appreciate clearer communication about their costs. Your staff will appreciate not being buried under endless paperwork. And you'll appreciate having one less major headache in running your practice. The question isn't really whether automation can help your billing processes, it's whether you're ready to make the change. Because at the end of the day, every minute you and your team spend fighting with billing issues is a minute that could be spent on patient care. And isn't that why you became a doctor in the first place? Thanks for watching.